Would you like to learn some useful tips that will help you alleviate your neck and upper back pain? Then stick around to find out. Hi, I'm Dr. Bill Tortoriello, and whether or not your neck and upper back pain are a result of slouching at your computer on Zoom meetings or laying back into the couch binge watching Netflix all weekend, I'm here to show you some specific stretches that can help you alleviate some of these chronic aches and pains. The first piece of practical advice I can give is to give yourself some type of low back or lumbar support. Whether that's in the form of a pillow or some towels wrapped up, you place that into your low back in between the back of the couch or your chair so that it helps to prop you up, because that's ultimately where slumping begins, in the low back. With your low back supported, the next piece of advice I can give is to rest your elbows and forearms on the armrests of a chair. Now, if your chair doesn't have armrests, I suggest scooting closer to the desk so that you could rest your elbows and forearms on the surface of the desk itself. This gives a little bit added support and protection to your neck and upper back throughout the day. Now that your back and neck are properly supported, I'm going to suggest some particular stretches in particular directions to alleviate some of that chronic stress. The first particular stretch is something called a simple chin retraction. I'm going to show it to you from the side, and it is exactly what you would imagine it is. What you're going to do is sit up tall and long. I don't want you to be squeezing your shoulders back or sticking your chest out. Just think of yourself as being nice and tall, shoulders broad and wide, and you're going to draw your chin straight backwards into the back of your skull, and then come back to a neutral position. Ultimately, you're pretty much giving yourself a double chin. That's kind of what the movement looks like. So again, full speed, it's not a huge stretch, but you're driving your chin straight back towards the back of your skull. Essentially, you're elongating and stretching the back of your neck, eliminating the prolonged position here and producing some elongation and stretch for the neck. Now, if you want to add to that stretch, if that stretch isn't as useful or effective as we'd like it to be, you can provide a little bit of overpressure to the stretch, which is literally you taking your fingertips and pushing your chin straight back into the stretch further. So I'm going to sit up tall, make myself long, drive my chin back, and now push my chin the extra distance back with my fingers, and then come back to normal. To make this stretch even more significant, we can add in what's called cervical extension or neck extension. This is essentially where, in addition to sitting up tall and long, driving our chin or retracting it backwards, we look up and back with our head and neck, and then come back to neutral. The key points here are we don't look up and back from a slumped position. We sit up tall and long, we perform the chin retraction, and then we look up and back from there, coming back to neutral. One small addition to the chin retraction and extending backwards is to give a little wiggle back and forth of the neck as you're looking up and back. Looks pretty much exactly how it sounds. We're going to retract the chin back, looking up and back, and then a little waggle back and forth, coming forward again. Back to neutral. We retract the chin, look up and back, and a little waggle back and forth. Back to neutral. One last piece of practical advice when doing this stretch is to add in the use of a towel. What you do is roll the towel up, place it behind your head and neck, and while performing the retraction and the extension backwards, you can pull forward on the towel as you extend up and back. This adds just that extra bit of overpressure or force that is sometimes necessary when performing this stretch. Now that we know how to perform our particular stretches, I'm going to give a general recommendation of performing a set of 10 to 15 reps, maybe 3 or 4 times throughout the day. If your symptoms are decreasing, great. If not, you can always try to increase the amounts of sets and reps you perform consistently throughout the day. Finally, if your symptoms worsen as a result of performing these stretches, I suggest taking a break, backing off, and slowing down with the consistency. You can always try them again at a later time, but if they continue to worsen your symptoms, they just might not be for you. Once again, I'm Dr. Bill Tortoriello. If you have any particular questions, feel free to comment below. And if you'd like to schedule an appointment with me today, you can find my contact information in the description.